Pain is part of our shared human experience. And while our preference is always to solve the pain, to correct the problem that's causing the pain, sometimes the best we can do is learn how to live with and manage the pain. So while I'm framing this video in the context of my hip journey, these principles can be used to solve and manage pain no matter what's causing it. In fact, I'm in a lot of pain right now, and it's kind of an interesting coincidence that that happened right as I'm filming this video. I'd wanted to film this the last 2 days, but really the pain prevented me from doing so. Stay tuned to the end where I'll unpack my current pain and what I'm doing to address it. But I'll give you a hint. It's not related to my hip. When I'm struggling with some sort of new pain, sometimes it's a matter of trial and error, and I find there is wisdom in the counsel of many. What I mean by that is you never know who might give you that one piece of information that helps you solve your pain or learn how to manage it effectively. While I can't guarantee that this video will help you solve or learn to manage your particular pain, hopefully it'll give you some ideas and lead you down a path that'll get you closer to that answer. I wanted to share some great resources if you haven't already checked them out. I've made it easy by including links in this video's description. My website, hipvlog.org, contains lots of helpful resources, including an email system that will send you timely tips and information directly to your inbox throughout your hip journey. So I hope you'll take a minute now to invest in your recovery by subscribing to my YouTube channel, website, and Facebook groups. If you like my content, please share it with others and check out my other YouTube channel, Game of Life 411. Who knows, we might have some other interests in common. Thanks for watching, and now back to the video. By the way, I'm Future Pete, and I'm currently 2.5 years post-op. When I first started my hip vlog, it was about the same time that I started my YouTube channel, and I really didn't know how people were going to use my hip vlogs. I just kind of wanted to document the process and share it in the hopes that it would be helpful to others. But now, at 2.5 years post-op, I've interacted with thousands of other hippies on social media and my YouTube channel and website, etc. And what I found is that a lot of us struggle with managing pain. That could be pain pre-op, post-op, during recovery, etc. And so I'm taking the opportunity now to combine my second and third hip vlogs to create one specifically about managing pain. And I'm excited about the opportunity to make these improvements and create this updated video to help more and more of you through your hip journey. Regardless what's causing your pain, I hope this discussion and these principles help you come to a resolution or find a better way to manage your pain along with your doctor's help. Now let me just refer to some notes and see what's next. Okay, I think it's time to change into something more comfortable. This shirt is so much more comfortable than my Starfleet uniform. We'll call this my Starfleet skivvies. And, it kind of reminds me of when I was a teenager. My friends and I used to do these 8mm films. We'd film battle scenes, and then we'd go individually frame by frame afterwards with a felt tip marker, and we draw in little laser beams. So I wonder if that still works, because I think I've still got that Future Pete label down there. Let's give it a try. Shoo, 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 shoo. Anyhow, you probably find that kind of distracting, and I did it for a purpose, because one of the ways we can manage pain is through distraction. Sometimes you can't get the pain under control, and the best thing you can do is just find a way to distract yourself away from it. So I'll talk about that a little bit more later. Okay, let's talk about the different kinds of pain. So I'll talk primarily in the context of my hip, but you can substitute in other problems, like a shoulder problem or whatever, a bad knee, and it's pretty much the same. So in terms of my hip, I had pre-op pain, which in my case was primarily felt as groin pain, and that actually delayed my diagnosis of having a bad hip because it wasn't actually so much hip pain as it was felt in my groin area. So I'll talk more about that a little bit later. Then you have the recovery pain, which is after you've had a procedure like a total hip replacement. You've got pain during recovery, and that can be a little bit tricky because within that, you've got a couple different kinds of pain. You've got normal pain, which is the pain you'd expect from healing and from the surgery and that kind of process. Or there's the bad type of pain, which is maybe you're overstressing your implant, or maybe you've overdone something, and you could be endangering the future success of your implant. So you don't want to do that. Then you have ongoing pain. And that's a sucky one, because ongoing pain, what I'm referring to there is, so you had pain before surgery, you had the surgery, and perhaps the surgery solved some of your pain or certain types of pain, but you have other pain and it's persisting even after the surgery. That can be pretty crushing psychologically, but it does happen. Now, most of the time, especially with total hip replacement, the outcomes are very good. It solves your pain, you get your life back, but there are also plenty of instances where it doesn't solve all your pain, or you might have other pain. And then the last kind of pain I want to mention is unrelated pain. And I mention it in this context because I experienced it, right? So I had my total hip replacement, And then about 3 months into my recovery, I started getting this pretty significant pain in my lower back on the opposite side. And I didn't know what was going on. I thought, is this related to my hip? Is it because my body's now adjusting to a new normal after total hip replacement? What's going on? Well, it turns out that the pain was unrelated to my hip, and that just complicated the diagnosis and tried to come up with a treatment. Now, that's been almost 2 years ago that I've been suffering with that pain. And I've gone through many diagnostic procedures. I've tried many things, and I'm still struggling with it. And that's kind of why I'm in pain now. Before we get into the principles of resolving and managing pain, I wanted to talk about a basic life philosophy or principle, which is that staying fit is better than being sedentary. It has all kinds of positive benefits for your body. I'm sure you've heard the phrases, motion is lotion and things like that. So when you're experiencing pain or you have some sort of a physical problem, you can't let that completely derail your fitness. And if you're not already fit, then it's never too late. And I would encourage you to adopt a fit lifestyle going forward. It's something that is absolutely possible. There are things that I've really disliked in my life. Abs, for example. I hated abs until I was about 50. And then I started doing them regularly, and I learned to really love and appreciate abs. And so now that's a part of my regular workout routine. So it's never too late. And, motion is lotion. And whatever you do, whatever kind of pain you're suffering from, the best outcome is to figure out a way to live with it and maintain your fitness, or to get around that pain. Or, really, the ideal outcome is we solve it and the pain goes away. But that's not always possible, especially as we age. Now let's hear from Pre-Op Pete about my pre-op pain. And remember, this took about 6 months for me to even figure out that I had a bad hip, right? Initially, it was primarily groin pain, and I thought I pulled my groin. So I was kind of treating it like that. So for 6 months, this is what I was doing. Starting in early 2022, I experienced pain in my left knee and then later in my right hip. And the right hip ended up being very painful, to where I felt pain both in the hip joint and also radiating all the way down my inner thigh to my knee. And it was sort of a sharp and burning pain. I'm going to talk about solving and managing pain with a simple 4-step process. It's only about 20% head knowledge and 80% behavior. What I mean by that is I'm going to explain to you the principles, but then it's really up to you to do it. And if you need to understand the value of patience, perseverance, and will, which are really key principles to doing this successfully, then please watch this video. The 4 simple steps are: number 1, identify the problem. Number 2, try something. Number 3, evaluate the results. And number 4, repeat as necessary. And that's it. Now, I'm going to get into more specifics about things that you can try, and I'll even create a separate document on my website, hipblog.org, which lists these things. So you can kind of go through and do a checklist and say, okay, have I covered all my bases here? Have I tried all these things? Hopefully that will lead you in areas that you maybe haven't explored before and help you find a resolution. I'm going to refer to some notes just to make sure I cover everything, but then I'll provide some additional commentary. So we've already identified the problem. Now we need to try something. What should we try? There are so many things. It's literally like an endless list of things that you could possibly try. So here is as complete a list as I can come up with. The simplest things you can try first are home remedies like rest, heat, and ice. And to see if any of these things are effective, you really have to try them for a few days or maybe a week each, just to see what the results are. Kind of in this category or adjacent to it are homeopathic remedies. And I personally haven't had a lot of success with homeopathic remedies, but a lot of people do claim success. And so that's great. And you know what? Even if it's just a placebo effect, that's okay. All that matters is that you found a way to manage your pain. The next category would be over-the-counter or prescription medications. And of course, I'm going to try the over-the-counter stuff first. So I tried all the pain relievers, the non-steroidal anti-inflammatories, the creams, all that sort of stuff, and nothing works. So I would still recommend, though, that you try all these things first. And once you've exhausted all the over-the-counter options, then you might talk to your doctor and see about any prescription options. In my case, my main problem was managing the pain, but so that I could get enough sleep to function. And so I tried a number of prescription things that my doctor provided. Some were pain relievers, some were non-steroidal anti-inflammatory drugs, some were sleep aids. And so I would try these things and see which ones would help. It's also worth noting that this could be a repetitive process, and that sometimes these prescription medications can have unforeseen negative side effects. So, for example, I tried an oral NSAID called diclofenac, and I don't know if it was working, but what I found is after maybe a week of use, I started getting muscle spasms in weird places all over my body, like in my shin or in my hands while I was driving, things like that. And it kind of freaked me out. And I didn't know at first that it was because of the diclofenac. So I stopped taking the medication and the spasms went away. I tried taking it again later, and after like 3 days of use, the spasms returned. This is by no means a common side effect of taking diclofenac, but it's just to point out that you might have some sort of weird reaction to a particular medication and you might need to try something else. So, subsequent to that, I told my doctor, and he said, well, here, let's try this other prescription NSAID. And we tried meloxicam, which is also known as Mobic. And I didn't have that same sort of side effect when using that NSAID. So, that's the one I ended up using. As I mentioned earlier, sometimes distractions are the best way to get your mind off of your pain. So, in one case, I had my daughter paint my fingernails, and that was a welcome distraction. As you're trying things, you may need to change your behaviors or your activities or reduce them. And I did that as well. I played less volleyball. I went for runs less often. I went for fewer hikes. And again, you try those things and see what the results are. But ultimately, I'm not willing to give up all activities. So, those were really just to help me narrow down the problem. And I was still trying to solve the pain because I still thought I had a groin pull. So I thought, it's a soft tissue issue. If I can just figure out how to solve it, then that pain will go away for good. The next tier of things you want to investigate are talking to different types of professionals, right? So you could seek a professional massage, a chiropractor, some sort of a pain specialist, ultimately an orthopedic surgeon or your family doctor. And all these professionals are going to have their own opinions. They're going to probably have you try things like physical therapy, and then you're going to have to judge whether those things helped you or not. But ultimately, you hope that it leads you closer and closer to finding an ultimate solution or a way to manage the pain. And in particular, some of the diagnostic procedures can be very helpful in identifying what your problem is. I'll talk about those a little bit later in this video because those all happened after I was diagnosed as having a bad hip. So after you've tried each of these things, then you need to evaluate the results. Did it help? Did it not help? And if it didn't help, then you go back to the top of the cycle and you start all over again trying something else. But the key is patience, perseverance, and will, and never give up. That was an extremely frustrating 6-month period for me trying to figure out what was causing my groin pain. And I sincerely hope that you don't have to go through that. Some of us have an easier diagnosis. We have pain directly in our hips. We go to the doctor, they do an x-ray, they say, oh, you have a hip problem, you have arthritis in your hip, you need a new hip. And, if you're going to have a problem like that, I'd rather have a quick diagnosis and not go through all the pain and suffering of trying all those different things for a long period of time. But that was my journey. So after 6 months, I was like, well, maybe this isn't a soft tissue issue. Maybe it's something else. And so I finally started seeing some doctors. I went to the orthopedic practice where they had done my shoulder surgery years before and talked to some doctors there. They did an x-ray and they said, yeah, we can see some problems. We can see some arthritis in that hip, but we don't necessarily think you need hip replacement. So then the cycle repeated itself, right? So we had identified the problem now. We were going to try some things, evaluate the results, and then rinse and repeat as needed. One of the things we tried that I mentioned earlier was a diagnostic procedure, and they did a steroid injection into the hip, which sometimes can bring pain relief for a period of months, but there are some restrictions around it, right? If you have this steroid injection in your hip, then you're not allowed to have hip replacement surgery for 3 months after that. So, there are some pros and cons to getting these things. But when they did that injection, they also included some anesthetic. And the idea is that the anesthetic is going to numb that hip joint, and that should tell you whether the pain you're experiencing is related to your bad hip. And sure enough, it did. Now, unfortunately, the injection of the steroids didn't help me at all, at least not that I could tell. So I ended up having surgery almost 3 months to the day after I had that injection. But if you remember, my surgeon still wasn't convinced that I needed a new hip. So after the shot didn't help, I kind of pushed him and I said, I'd like to get an MRI, and you might need to do the same. You might need to ask for an MRI. That's often sort of a second way of confirming whether someone needs total hip replacement or not. Or you might want to ask to see a different surgeon, depending on your situation. So when we had the MRI done and the surgeon took a look at that, he was like, Oh, yeah, now I can see that you actually do need total hip replacement because my cartilage was pretty much shot. So we scheduled surgery for 3 months in the future. And then something else happened. I had an opportunity come up to go hike the Inca Trail to Machu Picchu in Peru. And this is something I've been wanting to do for like 10 years. So I talked to my surgeon and wanted to make sure that it would be okay for me to pursue this because I both had to train for it and then I had to go do this hike and try and survive. So anyhow, I talked to my surgeon about it, he okayed it, and this next section of the video is about how I managed pain over the next few months, training for that, doing the hike, and getting ready for surgery. After successfully managing the pain while training for this hike, my friend Fernando and I proceeded down to Peru to start the Inca Trail. I had to go through a similar process there where I was struggling with the pain and had to try some things and ultimately found some solutions. To recap my diagnosis, my doctors at this point have said that I can do just about any activity so long as I can handle the pain. And whenever the pain is unbearable, that's when I need to have my hip replacement, which is currently scheduled for next January.
Regardless of what activities I engage in, my hip has already deteriorated to the point where I'm going to need a total hip replacement. So the doctor tells me the activity is good, it keeps blood flowing from my joints, and helps maintain joint mobility and my overall fitness level. When it comes to handling pain, I can usually handle it during the day, but the problem becomes getting a good night's sleep. So that's the challenge I face.
My long-term goal, of course, is to recover fully from the hip replacement surgery and then return to a fully active life doing all the things I love, but especially beach volleyball.
During this first week of training for the Inca Trail, I met with a new surgeon, started doing upper body weights and my physical therapy for the hip, and it was also characterized by very poor sleep. Still trying to figure that out.
Training hike 2 miles to the top of Elk Knob near Boone and 2 miles back.
This week I continued to train for the Inca Trail and also met with my primary care physician for my annual. Just coincidentally, the timing of that fell in this period, and that was very helpful. He told me to try some different things with over-the-counter pain meds, which really helped my sleep. Basically, he told me at dinner time to take some ibuprofen, then at bedtime to take acetaminophen along with the meloxicam. And as long as I take a sleep aid with that, I'm able to get okay sleep. But I don't like taking quite so many medications.
Last Wednesday, 2 days ago, I played volleyball in the morning and felt okay. And then the afternoon, I went for a 2 to 3 mile hike with my son. And after that, in the evening, I was just in excruciating pain. So evidently, that was too much for my hip. And I feel better today, but boy, I tell you, Wednesday night was misery.
Week 3 is my final week of training for the Inca Trail. At the beginning of the week, we were at home doing regular exercise. I tried switching to diclofenac again, but had the muscle spasms again, so went right back to meloxicam. During the last part of the week, we spent 4 days at the beach with friends, and so my exercise at that time was just walking along the beach for several miles each day. Monday, I fly out to Peru to hike the Inca Trail.
The hiking went well. It was a moderately strenuous day, so everything worked fine with the hip, no problems. However, when we went to bed, I took all my meds as usual, and once I laid down, the pain in my hip and radiating all the way down through my inner thigh and right knee was excruciating, just throbbing pain. I really didn't get any sleep last night. We'll see how it goes tonight. But today is supposed to be our hardest day of the trek. It's almost 10 miles. Lots of elevation change, potentially cooler, maybe some rain, hopefully not. We had beautiful weather yesterday. It was a little hot perhaps, very sunny. Anyhow, more later. Hi there. Day 2 of our hike, the Inca Trail. I think we're about 2/3 of the way through it. This is by far the hardest day. It's been pretty rough. We did have a pretty nice lunch break and a little siesta afterwards, but it'll be interesting to see how sore I am tonight and how the hip feels. I did take some meds a couple hours ago, trying to get ahead of the curve on that, so that I don't have as much pain when I try to turn in for the night. Okay, second night in the tent was a lot better. Yesterday was by far the hardest hiking day. Today should be relatively easy, but I started taking painkillers earlier in the afternoon, including the meloxicam. I took like a half a meloxicam around 5 or something like that, and then I took another full one, so a little more than I'm supposed to take, but I really needed to get some sleep. And then with all the other over-the-counter stuff, it made a difference. So I got a decent night's sleep last night, and looking forward to some good hiking today. Okay, we just arrived at Machu Picchu, and last night was a pretty good sleep. I think I've learned from my lessons. I think the first night I just didn't take my medications early enough because I was in pain when I went to bed, which was fairly early. And the last couple nights I've been starting my meds earlier in the day, but bottom line is I'm taking everything I have. So I'm taking ibuprofen, Tylenol, meloxicam, and occasionally some oxycodone just to be able to sleep. So everything's working well, and I'm glad to see that. Well, we're officially done with the Inca Trail. Slept pretty well, again taking all of my medications and anti-inflammatories and things like that. I'm really glad that on the Inca Trail I was able to figure that out and not have any problems. And my legs feel good, my hip feels pretty good. Everybody's been joking about how they have these really well-developed quads and calves and things after this hike because there was a lot of stair climbing. This is like stair climber on steroids.
There you go, Peter. The coca leaves are speaking.
Nice. It's long legs.
Long legs and coca leaves.
And short legs.
Yeah.
Okay.
Done. 3, 2.
It's also worth mentioning that using the walking sticks was fabulous. They were so helpful going both upstairs or uphill and downhill or downstairs. This particular trail actually had a lot of stairs because it's the Inca Trail, and one of the things that they did was carve stairs into the mountainside or put them together with rocks. I learned something on the trek that I didn't know, which is when you are walking uphill, you want to adjust them to be shorter. That's easier to get in front of you. And when you're going downhill, then you want them long so you can reach in front of you. But, again, highly recommend them. Super, super helpful.
I also wanted to mention that one of the reasons we often get total hip replacement is so that we can continue doing the things we love with the people we love. Well, I recently had an opportunity to go back down and hike a different trail, the Lares Trek, again to Machu Picchu in Peru. And this was with my eldest son. It was his college graduation trip, and we had a great time. And my hip at 2.5 years post-op performed admirably. Everything went well. So if you're interested in hiking and want to hear more about that experience, then please check out this video. As I promised earlier in the video, now I'm going to unpack my current pain and kind of explain what I'm going through there. And, I've mentioned that you often try different things to resolve pain. And sometimes you go for things that are a little bit maybe less traditional. So I just wanted to offer that up as well. You'll have to guess what's in that. So when I experienced this debilitating pain a couple days ago, I went through the process of trying to identify the pain and figure out what happened. And it's taken me a while, but I think I figured out what happened. It's the same pain. I have degenerative disc disease, which is something that happens to many of us with old age. Basically, the vertebrae have gotten compressed and there's some arthritis down there. It's compressing nerves and causing pain in different parts of the body. Well, my pain is in my lower back on the side opposite where I had my hip replacement. And Sunday, I got up and went outside at 6:30 a.m. to try and get in some weeding. So I was using the pump sprayer and bending over a lot, pumping it and spraying weeds. And then at 7 a.m., we went to volleyball, my two boys and I. We start at 7:30 a.m. so that we can get it squeezed in before church. And it was in that first game of volleyball that I really started feeling the pain, and it's a lot more pain than I've had in a long time. The other thing that I think contributed was that I forgot to take some pain reliever before volleyball. What I've been doing the last few months is taking something before volleyball called migraine relief. It's something that a buddy of mine told me about years ago. He called it like his Superman aspirin or something like that, because it would kind of erase those aches and pains before he would go out and play volleyball. And I'm not too concerned with having aches and pains, but what I have learned about my body is that if I'm in some pain, then I'm sort of predisposed to having muscle spasms or to pulling muscles or to having further injuries. So this is just a way for me to try and avoid those things. And it's been working pretty well. As long as I remember to take it like a half hour before volleyball, then I typically feel pretty good and I don't seem to have any lasting repercussions from playing the volleyball. So I forgot to do that as well. So combination of those factors, I think, is what caused my current pain. So the next thing then is try something. And I've already tried a few things. I'm on my third day. So today's Tuesday. This happened on Sunday. So the first day, Sunday, I was in a lot of pain. I basically took it easy for the rest of that day. I took some muscle relaxant to see if that would help, if it was maybe a muscle spasm or something like that. The next day, Monday, I didn't feel all that much better. So, that was my evaluation. And I had to try something else. I continued to rest, but I also used the ice machine I have that I used for my shoulder recovery and for my hip recovery. So I did that, every hour for about 20 minutes. I was laying on the ice pack and trying to ice and rest. And today, being the third day, I feel a little bit better, but I still feel quite a bit of pain. So today I'm again going to take it easy. I'm giving up on the ice because I'm not sure that it really helped. But today I am taking an NSAID that I think is called Celebrex. It's something that they gave me as they were trying to help me get through and manage the pain for this degenerative disc disease. So I'm going to try that for a day or two, some additional rest, and hopefully that will put me back in the right. It doesn't solve my back pain, because that's something I've been through many, many different things trying to sort out, and I'm still in the process. And unfortunately, because it's something that happens as we age, my next step would be some sort of surgery. And while the pain is very bothersome and it does sort of affect my life, I'm not sure I want to risk a spinal surgery to address it yet. So hopefully, I can just manage it for an indefinite amount of time. I have heard that sometimes this type of pain can go away over time. So I just don't know how that's going to play out. But as long as I can avoid having a spinal surgery, I think I'll try to do that. So wish me luck. Hopefully now using the NSAID and further rest will get me back in shape and I'll be able to continue on playing volleyball. I am skipping volleyball today. Tonight is my normal volleyball day. I've got 2 volleyball days per week. And I told the guys, yeah, my back's just a mess. I'm not coming out tonight. So unfortunately, I'll miss tonight, but hopefully it's an investment in getting me back out on the court. We've come to the end of our video, and I sincerely hope that you found this helpful in managing your pain or in coming to solutions for some of your pain. If you have a specific question, please post a comment, and I will do my best to help in any way that I can. Now, a couple tips. If you are undecided as to whether you need total hip replacement yet, then I would definitely recommend that you watch this video. It's got a nice guide with it that will help you decide whether it's time for total hip replacement. If you've already decided to go forward with total hip replacement, then definitely go to hipvlog.org and sign up for the Your Hip Journey email system. It'll send you timely tips, encouragement, and information directly to your inbox throughout your hip journey. It's a great tool. I model it after something that my surgeon did, and I just love it. I think it's great, and the feedback I'm getting from other hippies is that it's very helpful. I love seeing those emails. And anyhow, just sign up for that if you've already decided on surgery. And finally, I'd like to ask for your help spreading the word. So if you know anyone who might be suffering from a bad hip or facing hip replacement, or just anybody that you know who's in this sort of age range where it might be happening, please share my content with them, share it with friends, family, coworkers, etc. And if you've come up with any clever ways of managing your own pain, please post a comment. I'd really like to know.
It's your world and I'm just a squirrel trying to get a nut to move your butt.
Explore all the free resources and helpful information throughout your hip journey by joining the Pete's Hip Vlog community and subscribing to my YouTube channel, Pete's Hip Vlog. If you like my content, I hope you'll also check out and subscribe to my primary channel, Game of Life 411. Where my goal is to help you win at the game of life, whether that means finance, family, fitness, or something else. And remember, you're in charge of your own health.